This is the right atria is up here. Your right ventricle's down here. Left atria is here. Left ventricle is right here. This is the apex of the heart, which I didn't talk about earlier. Sorry about that. This is your tricuspid valve, which is the right-sided atrioventricular valve. These are the chordae tendineae, the heartstrings that hold the tricuspid valve in place. And these are your papillary muscles that anchor the heartstrings to the endocardium. This side, you have the mitral valve or bicuspid valve. It's also the left-sided AV valve. On this one here, this on the right side, represents where the pulmonary trunk comes up out of the right ventricle. You can see the pulmonary simular valve right here. On this side, you can see where blood would go from the right atrium through the, left atrium, through the bicuspid valve into the left ventricle and back up through the aorta. This is your aorta right here. And if we put, maybe not. I'm trying to see if this will all fit together. No. Okay. So
it doesn't
this
have
is
the
just
arch
the
and stuff.
ascending aorta,
Yeah.
no arch, but it does have a good ligamentum arteriosum. We've already done pulmonary trunk. Coming around to the back side, if this is your right atrium, then you know these two have to be the superior and inferior vena cava. Let's see. So then these that are feeding the left atrium, they have to be the right and left pulmonary arteries. Sorry, I have to stop and think about no. Pulmonary veins, right and left pulmonary veins. I have to think about that for a minute. This represents the intraventricular septum that separates the right ventricle from the left ventricle. They do show you really nicely what the myocardium looks like here. You can see that. What else is on here that you need to see? What else?
I think that's it.
Oh, coronary circulation. Let's do that. Let me put this thing together. You can pause it for a second. You should pause it for a second. Okay. Just because it'll take a second to get this on. Okay, so your coronary circulation. If you can find where your aorta is here, you can find the right coronary artery and the left coronary artery here. It's a little better on those other models. And then your circumflex artery.
Oh.
Circumflex refers to something that goes around, so it's really easy to find the circumflex artery like that. Okay, and the veins on top, but that's often the case, that veins are superficial to arteries, so that's not really a problem.
Okay.
Help a little bit?
A lot.
Okay.